Hi there, I'm Senator Lisa Murkowski. It's been quite a while now, but as a mom of two boys, I certainly recall how much excitement, but also anxiety comes with being pregnant. And I will tell you, I cannot imagine how nerve-wracking it must be to be pregnant during this COVID-19 pandemic. There's just so many challenges, so much uncertainty out on the horizon. So if you're pregnant, nursing, or hoping to become pregnant, you probably have a lot of questions out there. You might be on the fence about whether or not to get vaccinated against COVID-19. I'm not the healthcare professional, absolutely not. Nor do I certainly profess to know anything about maternal health from a medical perspective, but one of the things that I am able to do is bring smart people together, and I've got a couple of friends here that I hope can help me shed some light on some of the common questions about the COVID vaccine that we're hearing. So I would like to welcome Dr. Zink, Alaska's Chief Medical Officer, and Heidi Murkoff. You might not recognize Heidi's name, but when I tell you the book that she has written, she is the author of What to Expect When You're Expecting. Most moms that I know certainly know that as the go-to book on pregnancy. So two great people today to have a conversation. So Anne, Heidi, thank you for joining me. So before we get into the discussion here about maternal health and vaccines, Dr. Zink, can we get a quick update on the COVID-19 situation there in Alaska? And before you start that, just let me say again, my thanks, my personal thanks to you for being the resource, being the go-to person on the ground, and the one that so many of us look to in the state for good, honest, accurate information. So please, thank you for being with us, but what can you tell us about where we are with the vaccines in Alaska and just what our status is on COVID?
Yeah, no, thanks, Senator. It's an honor to be here, and with a hero of mine who wrote a book that also sat by my bedside as my two children were growing, and I had that same anxiety in that place. Unfortunately, we still have a lot of COVID, and we always are making risk-benefit decisions on everything that we do, from what we eat to what we take from over-the-counter medications to things like vaccine. And right now, particularly in Alaska, we have a lot of COVID. So we have had the most cases per capita for over a month now. We have just over 600 cases per 100,000 people. We have almost 500 new resident cases today with 5 out-of-state residents. We've been at kind of an awkward plateau for about the last 6 weeks, but we're starting to see some early signs of an early trend downwards, which is hopeful. And we continue to see people getting vaccinated. But I think the heartbreaking thing is how many people that we're seeing hospitalized, as well as how many people we're still seeing die from this disease. So unfortunately, our hospitals are still incredibly overwhelmed. So even like in the maternal child sections of many hospitals, they're having to care for patients who wouldn't normally be in the OB section because there's no other beds available. As you know, Alaska's huge, and being able to have the right care for the right patient is a priority for the healthcare system. But with our hospitals so strained right now, that's being challenging to care for COVID patients, but also non-COVID patients overall. We continue to see a slight uptake in vaccination rate. So currently 65.2% of those vaccinated with at least one shot. Every week, we still get about 2,000 to 3,000 people starting their vaccine journey, and really hoping that we can see particularly more women choose to get vaccinated, and particularly pregnant women. Unfortunately, today we have 6 new COVID deaths to announce, but looking at their dates and numbers, one was a woman in her 30s and one was a woman in her 20s. And to date in Alaska, we've had 24 pregnant women require hospitalization secondary to COVID, and we have lost a pregnant woman secondary to COVID. So this is a real threat to women who are pregnant. 97% of pregnant women nationally who are hospitalized are unvaccinated. And in Alaska, every single woman who's been pregnant and hospitalized for COVID has been unvaccinated. So in our data, we continue to see the real risk that not choosing to get vaccinated either prior to or during your pregnancy poses, just because pregnancy is such a high risk condition and we have so much COVID circulating right now.
Well, thank you for the update. It really is sobering to hear that, um, and to really put it into context with what is happening not only in our state but around the country. So, Heidi, both Dr. Zink and I have acknowledged that you are the go-to person for women who want to know what they're expecting when they are expecting. So let's turn to you. What concerns, if any, are you hearing from pregnant women, from nursing mothers, women who are trying to become pregnant? What are they asking about COVID-19 and the vaccines?
We're going to try to change some hearts and minds today, that's for sure, and get some sleeves rolled up for women who are planning pregnancy, hopeful dads, pregnant women who are pregnant, and women who are breastfeeding. It's super important. But first, I think we have to start with the premise, and it's a really, I feel it's a universal premise that every mom wants the best for her baby. And, every mom everywhere, it doesn't matter whether you live in Alaska or Alabama or California, Kentucky, you want your baby to be healthy and safe and protected. You feel that great responsibility. So when moms hesitate to get the COVID vaccine, that's really the mama bear in them talking. And I know you guys in Alaska are very familiar with mama bears, and they are a force to be reckoned. So let's first, address that. It doesn't matter whether you're a doctor or whether you're a senator or whether you work in a plant or store. I spoke to the director of the CDC about this, and she too confessed that when she was pregnant, as a public health expert, she worried about everything that she put in her body. So you wonder whether you should have that second cup of coffee or even the first one. You wonder whether you have to have your burgers well done and your salmon well done. And of course, you're going to worry whether you should get the COVID vaccine because it's something else you're putting in your body and you're not sure whether you should. So that's legit. It's completely legit. We have to, it's up to us to find out what moms' concerns are and what their questions are, and then to address them one at a time, mom to mom, with a big, healthy dose of empathy and compassion, because we all need that when we're pregnant. But starting with that premise that every mom just wants to keep her baby safe. Now, should I put the COVID vaccine in my body? What about my baby? What about before I become pregnant? Is it going to cause infertility? We've heard a lot of myths about that, about miscarriage, about complications, about stillbirth. We hear all of these myths circulating. And of course, pregnant women are worried about that. When you're breastfeeding, you worry about everything you eat and drink. Why wouldn't you worry also about a vaccine that you're taking? So these are all very legitimate concerns, but we have to address them one at a time and reassure moms that not only is it safe for them and for their baby, it's really the best way to protect for two, you and your baby.
So really, it is about validating these concerns. These are legitimate concerns, and as you say, we all, regardless of your background, whether you're a medical professional or really a very non-medical professional like me, we all worry about how we care for our bodies, because that's how we're caring for our child. And so these are legitimate concerns, and so how we get good, accurate information, I think this is what everybody's trying to do. So Dr. Zink, can you speak to the safety and the effectiveness of vaccination against COVID-19 for these women? Bottom line, do you recommend that a pregnant woman or a woman who's hoping to become pregnant, do you recommend that they should get a vaccine?
Thanks for that question. And, just like Heidi mentioned, I mean, I remember being so paranoid about every piece of cheese, every piece of meat. I love coffee, turkey, right? I gave it up immediately as soon as I found I was pregnant because I didn't want to do anything to potentially hurt my baby. Mm-hmm. I think it's really much harder to think about doing something to yourself, like getting vaccinated, when you're feeling fine, when you don't see the risk and the threat of something like COVID in front of you. And you see many people who have very, very mild disease and do just fine. That's very real with COVID. We see that happening again and again. So I think, just as Heidi mentioned, those concerns are incredibly valid. I think what's important is to separate correlation from causation. So just because you had a friend that something happened, or you hear some stories, breaking that apart from the data and the science. And what science does is it looks at what happens by chance versus what might be an effect of something like a vaccination. I think it's also important to understand how vaccines work. Basically, they don't stay in your system. They last in your body a couple hours to a couple days. They don't pass in the placenta. They don't pass to your baby. All they do is they teach your normal, healthy immune system how to build antibodies so that when you see the virus, with the Delta variant, we're all going to see it if we're interacting with other humans one way or another, so that you can take it down as quickly as you see it. It's building up that strong mama bear system. So using your own natural immune system to take it down. And the really cool thing about vaccines is that those antibodies then cross the placenta to the baby. The baby's entire immune system comes from mom. So that first 6 months of life, their entire immune system is from what you give them. And then over time, your immune system starts to wane in that baby, and they start to build up their own immune system. And then when they're 6 months old, they start putting everything in their mouth and they start building up their own immune system. 6 months to about 3 years of age. But the immune system really changes over time. And so if you can start your baby off on the best foot possible by giving them the antibodies against COVID, when they get exposed to it, when their cousin or their grandpa or their loving neighbor holds them, they'll be able to take down that virus really quickly. And the two ways you do that is to get vaccinated yourself so you can give those antibodies to the baby, and then continuing to breastfeed. So when you continue to breastfeed, it crosses into the breast milk and continue to do it. Honestly, vaccines are safer than most over-the-counter medication. They're the safest thing we do in medicine. So if I were to tell someone, the risk benefit, everything has risk to it, but something like Tylenol or ibuprofen compared to the vaccine, you're honestly safer with the vaccine, and the risk is much greater with COVID. And it's for that reason that not only do I strongly recommend that anyone who is pregnant, considering to get pregnant, or breastfeeding get vaccinated, but so does every major society that looks at women and children, their health, and the health of their babies. Their only goal is the health of you as a mom and you and your baby. And because of that, and this isn't the only vaccine that we recommend in pregnancy. We recommend influenza vaccine for a similar reason, even though the risk of influenza is not as great as COVID. COVID is much worse for a pregnant mom than influenza, even though influenza is at risk. And we also recommend pertussis because kids can get pertussis early on. And that's why, particularly after 26 weeks of pregnancy, it's important to do it. So honestly, vaccines are probably the safest thing we do in medicine. I was just looking at some data this morning, and let's see here. We have almost 50% of the world's population is now vaccinated, with 7.1 billion doses being given overall. And I think the amount of knowledge and understanding is built on hundreds of years of understanding the immune system, 20 years of understanding mRNA vaccines. And again, would not recommend anything that I wouldn't do myself. My children are fully vaccinated. My friends are fully vaccinated. My parents are fully vaccinated. And I'm not planning to have any more children. But if I was vaccinated as well myself.
That is really important, as you have outlined, really the safest thing that we can do, or the most effective thing that we can do when we think about protecting your baby, when you think about protecting yourself. That strong message to receive the vaccine is so important, and I think that you've laid that out in a way that even people that are not medical professionals get it and can understand and relate to it. I think we recognize, though, that misinformation about the COVID-19 vaccines has been a real hurdle. It's been probably one of the greatest challenges that we see out there. So I guess this question goes to you, Heidi. Where do you direct people who have questions about the impact of the vaccines on pregnancies or postpartum women for accurate information? Because everybody wants to know, where do I get the facts, ma'am?
The facts.
But when you think about the book that you have written, What to Expect When You're Expecting, you've got your online effort where you are there as a resource. But how can you direct women to good sources of information so that they can get themselves to this point of comfort that we've been talking about here, where they recognize that this vaccine is the safest thing for them and their baby?
And I think it's important that the three of us are having the conversation as moms. So we all bring something to the table, but the one thing that we do share is that we're moms. And I feel motherhood is the ultimate sisterhood, and we're all, no matter where you live, no matter what your socioeconomic, religious, racial, cultural profile, we all share that bond. And that's important. And nobody gets a mom like another mom. I maintain that. And I call, you go online these days. When I was pregnant, there wasn't any online, so I couldn't get that sense of support, that sisterhood. But now you can go online and get lots of support, also lots of opinions, lots of judgment, and unfortunately, lots of misinformation. I call the online community and the spreading of all kinds of information word of mom, right? Because one mom tells another mom, and that can be a really powerful tool if it's used to spread the right kind of information. But because it's so powerful, you have to use it really, really carefully. So it's fine to get insights about, the best breast pump ever, or, what to pack in your hospital bag. Those are opinions that are great to have, insights, advice from other moms. But just like you wouldn't go to a car mechanic to get your checkup on your baby, it's the same kind of thing. You need to go to specialists who specialize in what the kind of information that you're looking for. You're not looking for opinions from another mom so much on this, but accurate information that you can trust. And so we're super careful on the What to Expect app and the community boards that we moderate those conversations and make sure when disinformation is being spread and it's, one mom hears it, spreads it to another mom and to another mom. And it can be very compelling, but if it's not factual, then it's going to harm a lot of moms out there. So opinions of other moms isn't what you want to look for when you're thinking about when you're on the fence about getting the COVID vaccine or the Tdap vaccine or the flu vaccine. It's reliable sources like the CDC. They're the public health experts. It's fine to go to a friend if your friend happens to be Dr. Zink, right? Or Rochelle Walensky or any public health expert. You can even come to me and I will refer you straight to those public health experts because they're the ones who do the research. They're the ones who develop and test the safety of these vaccines exhaustively. So it's really important that you get the right information when you're trying to make those decisions. And then you can ask your friends, what should I pack in my hospital bag? That's totally fine. But let's leave the decisions about getting the COVID vaccine to the experts like Dr. Zink and the CDC and ACOG and the Society of Maternal Fetal Medicine and AAP, American Academy of Pediatrics.
Plenty of good sources that are out there, but it does require you to search and again, I think sometimes your first inclination is to ask your good friend or to ask your sister, to ask another mom. So One of the things that I wanted to bring up, since I've got the two of you here, there's a couple areas of concern that we've heard from Alaskans about in relation to the vaccines. And one is that there's this belief that vaccines can cause miscarriages or trouble becoming pregnant. So, Dr. Zink, as our medical expert here, as the chief medical officer here for the state, any truth to these concerns about miscarriage and inability to conceive?
They're great questions, and they're incredibly important questions. And I think they strike at the core of who we are in some ways as humans. There's nothing that we want to protect more as kind of humans is our ability to have children and our ability to care for our young. I think that they just are incredibly personal and incredibly real. I think that there is not enough conversation about just in general infertility and the risk of miscarriage. I think that's one of the things I appreciated about Heidi's book in some ways. There's a lot of things that we don't talk about except with our friends and family. So 1 out of 8 women do struggle with infertility. 1 out of 4 pregnancies end in a miscarriage. Most of those are in the first trimester. That's all outside of COVID. Those happen on a regular basis. And that is our body's way of honestly having as many healthy, happy babies as we can. Oftentimes it's an early genetic misalignment, and that's why people miscarry. It's incredibly common. Most women will miscarry at some point. And so it's important that we separate the vaccine from what we see with this kind of normal baseline rate of things like miscarriage and people struggling to get pregnant, infertility, which we see as well. And what we see across the board is that there is no evidence of causation. There's no evidence that the vaccine causes infertility, no evidence that the vaccine causes infertility the future times, not just right now, in the future, or causes problems such as miscarriage. That doesn't mean that people who get vaccinated might not miscarry. But again, it's incredibly common. It happens all the time. And so that's why I think it's really important not to just go on stories and anecdotes, but to go on the data and to separate correlation from causation. Talk to your friends about how traumatic, something like a miscarriage can be. Rely on those people. We need each other socially in so many ways. But when you're, again, trying to make a decision about something like vaccination, particularly when you're thinking about, fertility, talk to your doctor, look at ACOG. Heidi had a lot of great recommendations for Alaskans every single Wednesday from 12 to 1. We do a public science echo. Come up with questions. We have OBGYNs who attend. We have pediatricians who attend. We have immunologists who attend, and we will take any question from the Alaskan public. We've been doing this for almost 2 years now to make sure that you've got your questions answered. And you can always email our team at covidquestions@alaska.gov. So we will connect you to those resources, because just like you don't want to, don't ask me to do the electrical work in my house, right? Have our right experts in those fields come ask us questions. But separate correlation and causation and look at the data, because there's no evidence that the vaccines cause infertility or miscarriage.
And I want to point out also that goes for the hopeful fathers as well. There were some rumors circulating that this would make future dads infertile. That is not true. And in fact, having COVID may be linked to problems with fertility for men, but not the vaccine itself. And the other thing I want to point out is, you got questions, come to me too, because I answer every question that I get. Just come to @Heidi Murkoff. But for sure, take advantage of those resources that Dr. Zink is suggesting. We all have questions. We want them answered.
Well, we do all have questions, and we do want answers, and we want answers that we can trust. And that's why, to be able to have this conversation with the two of you, 2 women, 2 professional women, but also moms who we can trust. And I think whether it is to gain the professional medical advice, Dr. Zink, that you have, or that real life mom advice that you vet and then share, Heidi, I think these are great sources for women. And again, the excitement that comes with finding out that you are pregnant carries you for those full 9 months, but the anxiety that comes when you first realize that you are pregnant also extends for that full 9 months. And as a
18
mom,
years.
well, I was going to say, as a mom whose oldest is now 30, know that I still have that mom anxiety. I still wake up in the middle of the night thinking about my boys, now adult men. So you never get beyond being a mother. I think we all recognize that. But thank you both. Thank you both for sharing your views, your insights, your wisdom, your professional guidance on these issues that are so important today. So you've kind of summed up, I think, tidily towards the end, but if there's any one final message that you might want to deliver to those that are watching and listening to this conversation, I certainly invite you to. Anne, any comments that you might make as a final follow-on?
Yeah, I appreciate this time. I would say as a mom, make sure you're caring for your mental health throughout all of this, your physical health. COVID's been hard. It's isolating in so many ways. And so make sure you're reaching out and connecting. And then just please don't underestimate COVID. It is a real disease. And pregnant women are twice as likely to end up in the ICU, more likely to end up on ECMO, which we don't even have in our state. I think it is so heartbreaking to see sick women in the hospital, because not only are they sick, but then their baby's at risk and their family, who they are there to care for and support. There's so much more than just that one person. They're the heart of that whole family. And so we want as many happy, healthy babies and moms and families as we possibly can. And so please, if you have questions, come ask us. We want to make sure that you've got the same information that has made us feel so comfortable as moms, as individuals, as parents, to choose to get vaccinated. So thank you for this time.
Great, well said.
And I definitely want to echo what you said about mental health, and that the pandemic has been so isolating. And we've seen rates of maternal mood disorders, which aren't talked about enough anyway, increasing because of all the restrictions on pregnant women and their sense of isolation. So we need to all be in this together. And if you sometimes, you're strong up there in Alaska, everybody wants to be strong for their family and for themselves and for their state and for their country. But sometimes being strong means asking for help. And we have to make sure when moms ask for help that we provide that. Think of vaccines. You know how you like to swaddle your baby in your arms when they're born? Think of vaccination as a way to cocoon your baby even before they're born and just after they're born. It's really the power of prevention.
Yeah. Well, thank you both for being great mama bears. We appreciate you, and thank you for giving this very, very informative discussion today. Thank you so much. Appreciate it.
Thank you. Big hugs.
Back. Swaddling you.